home health agency. And when you do the jobs that I do, you're a community liaison, you're being around people and you're providing care, especially in your own community where people know you, they know your name. You want to keep a good product. And there sometimes comes a time when you just need to make a split. And it was that time. And things were just going south at my other business. I reached out to an old friend of mine. His name is Joe Allen. His family lives in Hitchcock. He had also done home health. And so I said, hey, Joe, and this was almost 2 years ago to this day. I asked him if he would be interested in doing a home health, and he said he would. So this has been a 2-year battle to get this thing going. So we actually started it. It's All Care Home Health. We actually started this process prior to the corona and the COVID outbreak, as I call it, the plague. And so we wanted to do healthcare right. That's why we started. My best friend is my patient care coordinator. He and I joined forces with Joe, and that's pretty much what got it rolling. And we started working together in September of 2019, and we're still fighting, with Medicare, CMS, the state, all that stuff. You have to go through a lot of flaming hoops. It's hard to start a small business, and then when you're dealing with the system, it seems like the odds are stacked against you. So I guess we thought we were smart enough and tough enough to do it. Now, we had no intentions of doing it during COVID. That just was, an added plus, a benefit that we couldn't have foreseen. So we're dealing with that. But starting small, it hasn't been too big of an issue because we don't have a huge patient load. Now, if you were an agency and you started and you had a huge patient load, that's an enormous amount of PPE, the protective wear that everybody uses for going in and taking care of people with or without COVID. If anybody knows anything about universal precautions, how that's handled, most clinicians are really well educated on how to adapt for that. So if you know anything about how the facilities, these seniors are contracting it in assisted livings, it's usually not the clinicians that bring it in. It's usually at the beginning, it was like either a family visitor or maybe like a caregiver, one that's not educated on the clinical side as much. So it's been easy to adapt. The hardest part of starting this business is the Medicare's changed the way billing happens. And I'm not going to bore you with all that, but it's a patient-driven model, and they don't seem to want to pay like they used to pay. So that's all changed. But again, we're adapting because we're smaller and we don't have a big caseload with patients. We're ready to get there, but we're still waiting. So we're in our very last stages, pretty much, of getting our Medicare number. And once that happens, then it's off to the races. We can go and we can start billing. But so for a year now, we've not been able to bill for all the work we've done. And it's been very tough. We're probably, I bet, over 300 grand into it out of pocket. And the financing came with everyone in Joe's family knew that his mother, Renee Allen, and his father, Joe Sr., they had all done healthcare. They'd already had their own home health, and they got out of it. And I guess me and Phil kind of drug them back into it, but they went and got financing through their family. And we're stretched pretty thin right now. So we're all stressed out waiting for that email to come, you've received your Medicare number, and then it's ready to go. And we have a lot of people in our corner. We have a lot of people that, clinicians, UTMB clinics, people we know, social workers that have always supported us, and they're ready for us to get going. But a year really takes the wind out of your sails.
Yes, it does. Now, Tom, you refer to CMS. What is that? What is CMS?
That's one of the agencies. So I'm talking out of my pay set here. So CMS, so you get your state audit in your survey, right? And you think, oh, let's go, we're ready to go. No, that's not enough. If you want to bill for all the managed cares and advantage plans and bill Medicare, they want you to get an accreditation through a separate agency. So you have to jump through that flaming hoop. We had to go through that twice. It's about $7,000 to do that. CMS is another bigger monster. I'm not exactly sure what CMS is. I know they're just one of the agencies you go through that deal with Palmetto, and they're who issues you their your Medicare license. So again, like I said, that's out of my pay scale.
And once you have your license number, will that be good across the United States or just specific to this area?
Here in Texas, that's where we're going to operate. Yeah.
I see. So you did get some limited financing through family and friends. Would that be?
Yeah, we're trying to do this all on our own and with support.
Yes,
So it's a
understand.
pretty organic process, for lack of a better term.
Very difficult to even get inside banks right now, let alone get a loan for a new business. It's just,
Right.
yeah, you've got a lot of cards stacked against you, and we wish you the best of luck. What will your role be in the business once it's
So
off the ground? It's okay.
as a community, I do the community. I'm like, people call it marketing. It's marketing to a degree, but it's like the community liaison. Doing what I do, I've managed to carve a pretty nice niche in Galveston Island. I'm in the Rotary, I'm in the Lions. I do a lot of volunteering, so I reach my actual community. But in all intents and purposes, people, what I do, they're usually number driven and they work for like big bonuses and stuff. And I've always chosen to work for like a smaller mom and pop agency, and I don't want a bonus. I don't want a bonus off of sick people. I just want to, carve a nice living for myself and help those that I'm involved in my agency do that. So, going to doctor's offices, educating social workers, people that own personal care homes and assisted livings, skilled nursing facilities, all those staff, just educating on them what we do. Once they leave, like if you've had a fall or some hospital visit, and you've had any sort of surgery post-op or anything like that, you're going to want to try to go to a skilled nursing facility. And if not, you're going to want to go home. Now, with the COVID, going to a skilled nursing facility or any facility now is tough, because once you go, you're not going to be able to it's starting to open up a little bit, but you're not going to be able to go see visitors or receive visitors because of the coronavirus. So that's kind of a thing that, people need to educate themselves on. So going back home is a really good option, and having an agency like mine come in and take care of you is definitely
Better than.
I won't say it's better, but it definitely seems to fit a lot of people than going into a facility. And poor seniors, they get alienated when they're away from their families, and this is been the hardest part of Corona.
We do know that. You did mention Galveston. So is your business serving Galveston County, or do you have clients in Brazoria County as well?
So it's funny because the family that I work for, they know people everywhere, and they have family in like the Lake Jackson area. So our goal is we already cover up to Albin, and then we would like to stretch that to Angleton and then down into Lake Jackson and cover that area. We are licensed for Brazoria County, but it's a matter of coverage. Can we get a nurse there? Can we cover it efficiently? And so we don't want to overstretch ourselves. We want to keep our product good and grow naturally, make sure if we find a great nurse in that area, to be part of our team, that's it. And what's chemistry is everything with an agency. You want good people, good caring people that love what they do and like working with others. That so far we have a great team. So as long as that keeps growing, we'll be okay. But yeah, we want to eventually cover that. But we go usually from our side. I'm over at like Highway 6 in Hitchcock. So pretty much 45 is that main corridor, right? So we go all the way down to the island. We will go all the way over, if we have to Pasadena. We'll go up to the Beltway pretty much in that area, Friendswood area. And
do you plan on opening a brick and mortar office space, or?
That's a funny story. Do you want to hear another funny long-winded story? Because I'm full of them. It's what I do for a living. I drink coffee and run my mouth. So my owners, Renee and Joe Allen, Joe Sr. is the sweetest man. He's really funny. Him and his son, my friend Joe, were driving around Hitchcock looking for an office. So they roll up at 8501 Hitchcock, and it's the old school tax office, I believe. And they walk in the front door, and this is exactly how the conversation went. Joe sees the man there, and I forget our landlord's name, sorry. But he goes, "Hey, I remember you from high school." These guys are 65, right? He goes, "I remember you from high school." And the gentleman says, "Well, I remember you." And he goes, "What are you doing with that spot next door?" And the guy said, "I don't know. What do you want to do with it?" And Joe Sr. said, "Well, I'd like to make a home health office." And the guy looks at him and he says, "Okay, it's free for a year. It's
Wow.
$800 a month after that, and then $1,000 after that." And he's not charged us until we started billing. So, it's funny starting this, like our angels have come from all corners, and I've managed to keep that theme in my life. You never know, you turn the corner, someone's there to support you. And when you get that, that was just one of those happenstances. They happen to know each other from high school. And that's the way small town guys do business. And so it's been great. And we went in there and it was all this old brown paneling and covered in like, I mean, you know, it was a tax office. That's back when people used to smoke. So we had to clean and scrub and paint, and it looks pretty nice now. We've done a pretty good job of getting it going. But yeah, it's the old school tax office at 8501 Highway 6 in Hitchcock, and we love it. It's great.
That's a great story on how you got your office space so early in your time with the business. I understand that you also continue to work for a local hospice. Can you tell us about your position with hospice?
I do. It's the same kind of position. I go around and I educate people on, you know, a lot of people don't know like what comes with hospice benefits. So it's nice to catch them early and have discussions with them before that time, because, you know, that end of life discussion is really difficult to have with someone when their loved one's going through it, you know. And so my old home health, we had a palliative program through another one of my best friends. Her name was Dr. Lee Grumbles. And a quick story about her is she was the head of palliative and hospice at UTMB. And she's just this brilliant little lady. I'll brag on her all day long because she is my best friend. My wife and I got married in her little courtyard over in Galveston at 19th and Post Office. So we're really, really close. But watching her work with our palliative program, I would say to myself, I don't know if I could ever do hospice. I don't know if I have the heart for it, you know, because I'm a big old softie, and dealing with people end of life is not an easy step. And I happen to be what I'm kind of an empath. Like, I will soak your energy up. If I feel some major sadness or some pain, like, I hone in on that. And sometimes it's hard to let go. But I have to say, doing this hospice, I've done hospice steady for a year now. And I've only cried 4 times when I'm talking with people and families. And it's usually, I can usually control, but I've had some zingers, some really sad things. But also, I never take for granted that it's an absolute privilege to be a part of somebody's, you know, and take care of somebody during that time, you know, through the end of life process and helping their families. That it's something I don't take lightly. From the time I get a phone call to the time they get all the equipment delivered to their house, everything, you know, it's a rush. It's a rush job. You can't have things go wrong while someone's dying. It takes a lot of work, and I've managed to come through a good team.
You mentioned palliative care. Would you explain to our students what palliative care is, and perhaps give us some hints how those who have Alzheimer's and similar dementias can qualify for in-home palliative care?
So I'll use some terms if you don't know, like, so it has to do with the acuity level of the patient. Like, where are you at? You may not, and I'm not a clinician, so I'm not going to tell you how to qualify, but your doctor or a neurologist or a geriatrician, a lot of times people keep going to their family doctors a little bit too long, and they may need a geriatrician. When I do the memory screenings through the Brazoria County Alzheimer's Awareness Project, which I love doing every November, sitting in Alvin Library, it's one of my favorite things to do. When I screen people, they'll be like, hey, you know, our old family doctor. I'm like, well, your family doctor has probably done a magnificent job getting you to this point, but you may want to get, you know, if they score low on that test, I always recommend that they go see a neurologist or a geriatrician, somebody that is a little more keen on picking up on seniors. And so, having said that, when you qualify for the services, you're usually going through your doctor, you know, doctor of geriatrics, and they're with you every step of the way. And they're going to tell you, you know, your dad qualifies for home health. You know, it has to be a homebound status. He may need this and the needs, and the doc will discuss with you how you qualify. So there's a stretch of life sometimes between home health and hospice where you don't quite qualify. You may have, obviously, you know, as well as I do, dementia and a lot of heart diseases is prevalent, and they're progressive, and if they're chronic, you know, there's no cure for dementia. There are things that slow it down. And so depending on what stage you get to, and again, I'm not a clinician, so I'm not going to go there, but depending on what stage or what level you are, you may qualify for some home health. And then that palliative stretch is usually a patient that's got a higher acuity level, that they need more, but they don't quite qualify for hospice. I think a great talk given by Dr. Grumbles is with some of her palliative patients. You no longer seek aggressive treatment when you're ready for hospice too. So when you go on hospice, there's no more doctor visits, no more ER trips to the ER, and those things can really wear you down anyway. So you have a nurse that answers to a doc that takes care of you on call 24 hours a day. It's a pretty beautiful thing. And it should your health change in any way, acuity level, you can get what we call kind of a critical or crisis care nurse will come out and sit with you for 12 hours until they manage those symptoms. But going back to the palliative approach, you know, MD Anderson has a culture. It's a beautiful culture. They're like refuse to lose people. You will not die. They don't want you to die. But there's also a level or a certain level of care that you can give, whereas you might be over treating someone. And so the palliative approach is to treat and manage the symptoms as best you can without being too aggressive. And it's pretty cool. And Dr. Grumbles gives a great talk, and it's about outcomes. And I'm stealing this from her, but it's beautiful. She may have a family or a patient that says, well, you know, you've got cancer, and you all know where that may lead you. You may have 4 to 6 months. And however, I'm sorry guys, I'm really long-winded, but you know, you may have a longer time to live with aggressive treatment. So the family makes the decision, well, can I live for another year? Okay, let's make that decision. Let's keep that around for another year. Now, going through chemo, you know what that does to your body. Going through all sorts of aggressive treatments for treating, you know, how they treat cancer. It's rough, you know. You may live for another year and a half, but you also may live not quite the quality your 6 months were prior to that, because you're sick all the time from the chemo, you know, and it's a rough go. Now, at the end of that year and a half, it's called positive outcomes. From a medical standpoint, it was a positive outcome. We have extended your life by a year to a year and a half. But from a quality of life standpoint, you were sick and miserable all the time from the chemo. So was it a positive outcome? So you weigh that. So that's a good way to explain, I think, the palliative approach is, you know, the culture between palliative and that, not to pick at MD Anderson, they're amazing, but to compare the two, it's pretty amazing. Like the culture is like MD Anderson, we refuse, no one dies on our watch. We don't lose anyone. And that's an amazing attitude. And they carry it like a badge. And I love that. But, you know, when you listen to Dr. Holmes talk about positive outcomes and you watch, you know, what aggressive treatment can do to your body, was it a really good last year and a half, or was it miserable and painful? And so that's hard to face. And I have these conversations with people a lot.
Personal note, Morris was on palliative care here with me for 3 years. And it was wonderful because I no longer had to take him to the doctor and deal with the waiting rooms. Right. That was the biggest problem, was dealing with that. We wouldn't know if we would be waiting 15 minutes or 3 hours. And that is a problem for someone with a very short attention span. And it was wonderful because the nurse practitioner came out to the house every 2 weeks. And
that's a good program. That's not always easy to do.
And he was still able to go to urgent care and places like that if he needed an X-ray. We tried going for an X-ray, and then we found it was even better to have mobile X-ray come to the house. Then we started having mobile lab for just urinalysis and blood. But the lady they were sending was driving from Denton.
Oh, wow.
By the time his insurance paid the bill, it was hundreds and hundreds of dollars in travel expenses for a $14 blood test. So I view that as a wise use of taxpayer money. But I absolutely loved the service that he received with palliative care because we were still able to go out, and this was prior to the pandemic. Then all of a sudden, his insurance company, because he has an Advantage plan, said he no longer could receive palliative care. He had to go on hospice. But he hadn't been unusually ill. Yes, he has occasional infections and some COPD, some CHF, but mostly the Alzheimer's complications. And we were forced into a hospice situation because of his insurance. And that has turned out to be a good thing. He's had 10 months so far with hospice. Yep. And the difference is they do send, I do have a shower aide who comes out to the house, and that helps me. And I do have the music therapist who comes out, and that's very enlightening for him, makes him feel good and all of that. In addition to the doctor coming every 2 months and the nurse every other week and keeping up with his prescriptions. So I really don't understand how his insurance that he has paid for years and years and years said they could no longer provide palliative care. when the only thing that changed was he got a year older. Well, actually 3 years older. His condition remained the same. So could you explain what's going on with Medicare and how they draw these lines between palliative and hospice?
So first and foremost, I am not a Medicare specialist. I am not a social worker, and I feel sorry for my social workers because it's always changing. I will say this, and not just well, we're on the record, but I'm not a big fan of insurance companies because, like you said, they would no longer refuse, and they wanted him to go on hospice. Well, of course they did. Here's with the Advantage plans that I deal with and the managed Medicares is once you turn 65, if you're going to go on hospice, they no longer want to pay for that. So they convert you back just for our benefits, for hospice benefits, to traditional Medicare. And now that should tell you something right there. They don't really want to pay for, insurance companies, private, they're not in the business of paying out. They will, but I'm just saying, I'm not a big fan of that. I suggest if you can afford your premium, stick with your traditional Medicare once you're 65, no matter what you have. You won't have a nurse that has to drive from Denton. You'll have a local nurse because everybody accepts traditional Medicare through hospice. You said earlier that the insurance company said that he needed to go on hospice. Now, technically, he has to meet criteria, and a doctor has to write an order. So I'm sure that all happened. But I don't like it when, I don't like it when insurance companies, however you want to call it, whether you got to get pre-authorization, prior authorization. I don't like it when they start making decisions for my healthcare. I want my clinicians to do that, and then I want the healthcare to back it. And so I'm not going to say much more about that because the battle right now is getting some of these managed plans because they're not Medicare replacement plans because they don't pay as well as traditional Medicare. So that's one issue I have with them. And then everybody has to fight with them all the time. So other than that, if you're younger and you're healthier, I think they're great. They're lower benefits. Sometimes you can get your prescriptions paid for and some other things. They give you a free toaster, whatever it is. It's an insurance company. But once you need it, nothing beats that traditional Medicare. Like my doctor friends that turn 65 say the first thing they're doing is keeping their traditional Medicare. But they've had good insurance. So, and then they keep the rest as a supplement. So you want that prescription plan if you can't afford Part D, So, and again, I see seniors every day dealing with this, trying to cope with figuring out their insurance. And I'm not the answer. I call my social worker. I always tell people I'm not very smart, but I know a lot of smart people, and I let them sort that stuff out.
Now with your business, I know you're waiting for your Medicare number where you will have clients whose fees are reimbursed through Medicare to you. Will you also have private pay?
Yes.
Type of agency altogether?
Yes, you will be able to pay privately, and then once we receive our Medicare number, we will apply for as many contracts as we can with all of those private insurances that I was just dogging out, excuse me, but you have to use them because everybody has them. They're a necessary evil now. And so we get a lot of patients coming out of the hospital. And one of the other hard parts is you want, as a small agency that's good and that's local, you want to be able to use those guys. We can't always get contracts with all of the private insurance companies, the big ones, Humana, Blue Cross Blue Shield, United, all those. We have to apply for that. And hopefully they won't tell us, well, we already have too many providers in your area, because what happens is a home health agency, just to say, I'll use them as an excuse because they're big, Texas Home Health, they probably take a multitude of these plans, but they're probably not going to take more than a few here and there a month. They don't want their entire billing process to go through United, so they'll mix it up. So what happens is, especially if it's a smaller agency, they'll accept like United Healthcare for a while, but then they'll say, well, we've taken 4 this month, we don't want to take anymore. So then the next person that needs that may have to go to another agency, and that's how it happens.
I know that we are running a little bit short on time, but I wanted to ask you, especially for those people who are dealing with the progressive ailments such as Alzheimer's, must you qualify for palliative care first in order for Medicare to reimburse home health care expenses? How can we help our people get home health care expenses covered?
Okay, so you don't have to have palliative. Palliative is a kind of a luxury program, and not everybody has a palliative program. Palliative is usually, If it's done right, it kind of looks like hospice. If it's done right, it kind of looks like an extreme home health, but it's paid for and billed as a home health. Okay, so it's a nice step to have. If your home health agency has a palliative program, it'll get billed through Medicare through the home health side. And with the hospice side, you have to qualify. You have to meet a certain criteria, and your doc needs to be there walking through there. What I would like to educate people on is, don't fear hospice. I go into people's houses all the time, like, so I'm dying? I'm like, no, you're not dying. Hospice is the one time, and we talked about this, Jeanette, like, you get everything. It's a one time, not everything, but you get almost everything through the benefits paid for. Like, if you have an incontinence issue, diapers and adult diapers, they're expensive. Gloves, they're expensive. The bed chucks to put over to save your sheets if there's an incontinence issue, that saves you. Those are paid for. So a lot of those equipment.
Yeah.
Yeah, equipment, shower chair, a bedside commode, a hospital bed. If your disease progresses and it gets to the point of where you no longer, you're bedbound and you no longer are up and you're mobile, someone comes in, you get a caregiver that can come in up to 5 days a week. It's usually Monday through Friday. It's usually 2 or 3 times. But if you progress to where you need a bed that goes up and down, so she can give you a bed bath. That hospital bed's paid for. A wheelchair, maybe if you need a rollator, walker, if you need an over-the-bed hospital table. Those are, for feeding. Those things are worth their weight in gold. And like I said, Medicare doesn't pay for all of it, but they pay for almost everything. And it's the one time they almost get it right. So I see people go without hospice because they think it's just when you're dying. And so hospice comes in for the last 4 days of someone's life. And that's heartbreaking to me because, dementia, Alzheimer's, it's progressive. Something related to Alzheimer's, your brain starts to go away. Like that's what's going to probably cause your end of life. And if you've been suffering that for months, you may have qualified for all of these extra benefits, because as well as I do, it's exactly why the Gathering Place started. And there's a multitude of training out there for family caregivers. When you're a family caregiver, you're taking care of your own loved one. It is the most stressful job on the planet. I hear ladies talk and she's like, the other day I wanted to shoot my husband. You've heard this 1,000 times. And so it's just like they get stressed out. I tell people when I go in for hospice, I'm here to take care of you and your loved one who is my patient, because it's all about the family and it's all about that support system. I know those are harsh words, but when you've loved someone your whole life, my mom and dad bicker all the time, and that's what kept their marriage together. And then now my dad's starting to have some dementia, and now they bicker even more. So yeah, she says, I can't sledgehammer him, but I love him.
Good. Very nice parting words. Well, thank you so much for joining us this morning, Tom. It's been very enlightening. I wish that we had more time and you could tell us about some of your experiences with Dale and Brenda, but maybe that'll be for another.
I'm going to look them up and come see them. I'm going to come see Brenda. She's one of the most tenacious people I've ever met. It's what attracted me to help be part of what she does. I was pretty proud of it when I did it, and I'm looking to try to, in the next year or so, get back over there in the Brazoria County area and see you guys.
Excellent. We're looking forward to seeing you once this pandemic is lifted. I'll probably see you at various fundraisers and volunteer things that we have with Gathering Place. But again, thank you for joining us.
Thanks for having me. It was great.
UTMB's Michael is